Are dental implants safe? That's a great question. I get it all the time actually here in my office. So, dental implants have been around since the mid 1960s. Okay, there are different formulations. Most implants are called commercially pure titanium or titanium alloy, and there are other ones that are non-metal, which we call zirconia implants as well. I can tell you across the board that dental implants are safe. I've placed more than 10,000 dental implants, and I have never personally seen an allergy at all. They are reported. Can it be possible? Yes, it's extremely remote. I have yet to see it, and this is all that I do over 20 years. Oftentimes, some patients have some immune system problems that make the implant appear that it may be something that they're allergic to, or that the implant could be unsafe or reject from their body. But the reality is dental implants are very safe. So titanium and titanium alloys integrate to the jawbones. That means that your body accepts them. It doesn't really see them as a virus. So here we're in the middle of COVID-19 right now. I'm making this video, and your body would see that virus and would recognize it and mounts an immune response to try to kill it. So in the body, your body can't see the implant at all. It can a little bit, and there are some poorly made implants that they can shed little layers of I wouldn't call them toxins, but little titanium particles off into the bone that, the jury's out. Could they cause a problem? Really, I have not seen that at all. I use a very high grade manufacturer. I prefer a grade 5 or grade 23 type of dental implant that is an alloy that's very strong, that doesn't break, because the problem with some of the very pure implants or the zirconia implants is that they break. So even though they may be technically a little bit more pure, they have a lot of problems where the wall or the connection will break off. You'll have to have the whole implant pulled out of the bone and redone again. Keep in mind, about 35% of my practice is redoing implants and revising them, and part of them are broken implants. And we actually see a lot more today than I did in the past, because there are some really thin-walled implants that have come out that a lot of them are based out of some of the Asian nations, um, that they break. The top just comes right off. I'll post a link to that as well. So dental implants are very safe, obviously, when done properly. And I'm talking about from a standpoint of, does your body reject them? Of course, you have to be medically assessed to make sure that you're healthy enough for it. And I can make a separate blog post on that altogether about, the health of us before we have an implant, because that's extremely important. If you're not healthy, the implant may not heal well, the bone graft may not work, and the teeth, it come loose, because the implants are not really permanent. They're permanent in that they stay in place, but they don't they may not last your whole lifetime. So have it done right the first time for sure. And from a safety standpoint also, people are really focused on the implant themselves. And I mentioned zirconia as the implant not being a great material. Zirconia for the crown or the bridge or the abutment, meaning the top part, not the part that goes in the bone, but the white part, or the part that goes just through the gum to connect to the implant. Zirconia is great for crowns and bridges and abutments. This is not great for implants themselves. So my suggestion is a grade 5 or grade 23 type of implant. If your dentist does not know what grade their implant is or what they use, they may not have a lot of knowledge on this particular topic. And there are better implant. Most of the implant manufacturers are good, but there are some that really the layer can shed off and leave kind of like a, let's say, a residue that your cells can see that's really not supposed to be there. There's certain like coatings on the outside. None of the implants that I use are done that way at all. I'm very, very selective about what I use on my patients. I've placed more than 10,000 implants, and I've followed them up for 20 years at this point. So I really have a good feel on what I feel is right and what works. And I can tell you with assurance, I've placed implants in my own family, and I would place it in my mother, my brother, um, everybody would benefit from having dental implants as long as you're medically safe to do so. So thanks for watching.